Hi, everybody. Brett Christopherson here with USA Today Network Wisconsin, and this is today's coronavirus 5 and 5, our 5 minute rundown of five of the top stories by our network of journalists who continue to report on the COVID 19 pandemic. We'll kick it off with a look at the latest numbers. States confirmed cases of coronavirus surpassed 20,000, but percent positive rate continues downward trend. Of 12,322 new test results reported by Wisconsin health officials on Friday, 357 were positive for the virus, or 2.9%. That's the lowest rate since Sunday and less than half the state's cumulative rate of over 6%. It was also less than half the record number of new cases the previous Friday, which was 733. Matt Piper writes that confirmed case increases have tended to peak later in the week, possibly due to a lag in testing and reporting over the weekends. But the last time new cases announced on a Friday were so few was back on April 24th when 304 cases were announced, a single day record high at the time. Seven more deaths due to COVID 19 were added to the state's count on Friday, bringing that total to 633. The number of patients hospitalized with COVID 19 in the state stayed level Friday at 355, according to the Wisconsin Hospital Association. Of those hospitalized, 124 were in intensive care. Moving on to this headline: dramatic changes coming to Wisconsin's court system due to the COVID 19 pandemic. Imagine jurors sitting 6 feet apart during criminal and civil trials, witnesses testifying while equipped with face shields, judges, prosecutors, and defense attorneys wearing masks during courtroom proceedings. It's not so far fetched. In fact, it will soon be the new reality in courtrooms throughout Wisconsin. Andy Thompson has the story. In it, he writes that the dramatic change is due to the coronavirus pandemic as officials grapple with resuming full courtroom operations while ensuring that the participants and the public are all safe. According to Outagamie County Circuit Judge Carrie Schneider, quote, "It's going to be unlike anything we've had before," end quote. You can read the complete story online. Our next headline is this: COVID 19 patients who survive respiratory syndrome are likely to face deep financial struggles. For those infected with the new coronavirus, simply surviving is the top priority, but a study suggests that some survivors will face long term financial burdens that could run into hundreds of thousands of dollars for a single patient. The Journal Sentinel's Mark Johnson reports that the study by researchers at the University of Michigan and several other institutions examined the cost borne by people who suffer acute respiratory distress syndrome, one of the severest complications of COVID 19. Published in the journal Critical Care Medicine, the study examined ARDS survivors in 2017 and 2018, well before the new coronavirus was discovered late last year. Mark writes that ARDS is an extreme shortness of breath that leaves vital organs deprived of oxygen and often forces patients to be hooked up to ventilators. It's a complication that can be brought not only by COVID 19, but a wide variety of conditions, including pneumonia, flu, and severe trauma. Check out Mark's story online. Next is this headline: one in four state nursing homes hit by COVID 19, data shows. One in four Wisconsin nursing homes have had at least one case of COVID 19, with one Milwaukee facility reporting 57 deaths, according to federal data released Thursday. But the data, highly anticipated for weeks, is also deeply flawed and underestimates the scope of coronavirus in U.S. nursing homes. One result, according to the Journal Sentinel story, is this: several months into the pandemic, citizens in Wisconsin and across the nation remain in the dark about which nursing homes have had the largest outbreaks or have the highest death rates. You can read all about it online. And we'll close today's 5 and 5 with a headline that sets us up for what looks to be a beautiful weekend of warm and sunny weather. Dining moves outside for the summer. Outdoor dining is a popular draw during any summer, but make that a double during one with a pandemic. As bars and restaurants slowly begin to reopen to dine in customers after the coronavirus shutdown, being able to offer a dine outside option is proving to be the key. Reporter Kendra Minert checks in with restaurants throughout the Green Bay area to see what strategies they're using to make sure their customers are safe as they dine in or dine out. Some restaurants have even expanded their outdoor seating into their parking lots. Kendra's story also includes a list of Green Bay area bars and restaurants with outdoor seating. Find those stories and more coronavirus coverage on any of our 10 USA Today Network Wisconsin websites and jsonline.com. One more item: before we wrap it up for the week. Again, please sign up for a digital subscription to any USA Today Network Wisconsin website. It's just $1 for the first 3 months and gives you full access on any device, mobile, desktop, and tablet to all our local stories, photos, and videos, plus news and sports from around the state. If you want the most complete, most in depth coverage of what's going on in your community and throughout Wisconsin, we've got it for you. Just go to any of our USA Today Network Wisconsin websites and click on the subscribe tab at the top right of the site. We truly appreciate your support. That's it for now. Have a great weekend.